Easy.
Welcome back to Living Dayton, everyone. So there's a different set of rules and tricks when it comes to your skincare routine for a variety of situations, but it's especially important if you're going through chemotherapy. This is one we never really think about or talk about. Sure. Marta Ray is back to help us pamper our skin against the harsh effects of chemo.
Yes.
Welcome.
Yeah, thank you, Natalie. Well, I thought it was very appropriate to talk about skin cancer.
Skincare.
Skincare
when you have cancer, yeah.
Any kind of cancer. I mean, skin cancer, breast cancer, they have different effects on the skin.
Right.
And this month is, Breast Cancer Awareness Month for October. So I thought it was very appropriate to talk about the different changes in the skin through cancer, and then also to make people aware that it's a specialty that I offer within my practice.
You do it yourself?
It's called Oncology Aesthetics, and it's a specialty to treat those patients going through chemotherapy and radiation with a specific skincare treatments.
Okay, so
what have developed.
What are the biggest issues that people going through chemo, what are the biggest changes that they see in their skin?
Right, well, there are two different things that they're going to go through usually. They're either going to have cancer drugs be given to them, or they're going to have radiation. Now, there are different little side effects from both of those things that affects the skin. Most people will complain about dry skin, edema, which is a skin irritation and swelling, flaky skin. They will have things like changes on their hair because, for example, radiation not only kills the cancer cells, the skin cancer cells, but also it will kill the good cells.
Yeah.
So when that happens, for example, it kills also the sebaceous glands. So a lot of people, they stop sweating as much, so they become very dry, and also, they lose their hair because it also kills a lot of the hair follicles. So that's some of the changes that I'm going to go through. But mostly irritation, edema, which is swelling, flaky of the skin. So there are little things they can do at home to make it better.
Okay, and I assume it's not those products that you can see on that are full of fragrances and they made by this company and that, and they look pretty. It's probably very simple that you need, right?
Yeah, it's very simple. Usually you want to look for very pure products, and usually they're going to be paraben-free and paraffin-free products.
Paraben and
paraffins free, and very, very low in chemicals, obviously.
So read the ingredients in this case.
Yeah, read the ingredients, but usually very mild, pure products. So, no chemicals involved in anything that you're doing.
Okay.
But there are the little things they can do at home. For example, again, like when they do not take hot showers, but take lukewarm showers. Pat the skin softly when they come out of the shower. Use sunscreen. A lot of cancer patients will not go outside of the house during the day when the sun is shining.
Right.
But if they're going to go outside, make sure they protect themselves with a hat and sunglasses and so forth.
Especially important.
Especially important. But then, for example, in areas that when they do radiation, sometimes they get what is called radiation burns, and that specific area needs to be treated correctly.
Okay.
And also pigmentation changes. It's very common for people to, develop a lot of hyperpigmentation from the radiation or the cancer drugs, or also they have a lot of broken capillaries. They're called telangiectasias, and those are usually broken through the process.
A lot of things going on with this.
Yes.
I have to wrap it up with you. I don't want to cut you off, but I do want to say that if people want to get more information, because you also can treat this in your clinic.
Yeah. If they want more information, they can go to Marta Ray, and specifically, I have 2 protocols for oncology aesthetics, and I offer those protocols of skincare treatments at the discount prices for those people that are going through chemotherapy and radiation.
All right.
So that's good for them to know.
Check out Marta Ray if you want to get any more of that information. Thank you very much.
Thank you, sweetie.
This is the easy part, by the way, if you're going through cancer, but if you have to talk to your kids about it, that is very, very difficult. Jim Booker has more on that.